My name is Dr. David Musoke. I'm a lecturer and researcher at Makerere University School of Public Health. I live in Wakiso district in Entebbe, and I work with community health workers who brought me in this community today. And the background of the community health workers, or CHWs as you normally call them, is that in many of our communities, access to health care is not as much as we would have wanted, especially in terms of getting the health facilities. So for that reason, the Ministry of Health many years ago felt that communities should have people selected by their residents who have been trained and can support in health care generally. So health care includes health promotion, so health education, mobilization of the community for public health interventions, be it immunization, distribution of mosquito nets, treatment of childhood illnesses, and many others. So these volunteers play a very big role as the first contact of care to the health system, and also play a link between the community and the health centers. And that's why one of their roles is to refer patients that they can't manage to the health centers so that they can get further care higher in the health system. In the Ugandan context, community health workers are volunteers, and we normally refer them as village health teams or VHTs. The volunteerism, of course, has its issues, as you'd expect, but over the years we've realized that despite being volunteers, they still do a good job. But if you support them in a number of ways, including enhancing their training, motivating them, with small incentives, sometimes not financial, a simple t-shirt, gumboots or umbrellas, sometimes makes them feel appreciated, and many times they perform a bit more than those who may not have some of these. So they do a great job, but with a little support, they will probably do much more. So as you would expect, a health system is quite broad, and it has so many building blocks, including governance, including financing, including human resources, including materials and supplies, including information. I must say, in all the building blocks in the country, we have challenges. If you talk about governance, we've realized that there are a lot of governance issues. Many years ago, as an example, we heard of a lot of resources that had been given to Uganda to support a number of diseases, including HIV, malaria, and tuberculosis, which were not managed well. At the end of the day, the beneficiaries didn't receive the funds, and the donors later on pulled out the funds. So you can imagine a country that is struggling with resources to have a donor pull out resources that are meant to support. So governance, certainly there are challenges. If you talk about information, again, as a national health system concern, I don't think we've done a great job in terms of collecting information regarding health, right from the community health workers to the highest level of the health system. If I talk about financing, again, very big issue. Uganda is a developing country. We've not met the 15% required of budget nationally to go to the health sector, which is, again, quite challenging. I would expect that the government should be putting a bit more resources in health. And for that reason, a lot of support that we get is from donors, both at national and lower levels, which is great that it supports the health system and tries to eliminate that challenge of limited resources, but also has a challenge that sometimes, due to donor support, the priorities of the donors sometimes take precedence as opposed to the local priorities. So for example, if a donor wants to focus on malaria and HIV and TB, that could be the direction we go. Yet interest may now be in non-communicable diseases, which is now, a critical issue. So sometimes external donor support is good, but it could have its limitations in terms of what it can do and what it can't do. I think non-communicable diseases, although not necessarily the main killer, we've seen a tremendous upsurge in recent years. If you look at the statistics 10 years ago and where we are, you would find that the number of cases of NCDs has increased, be it cancer, be it obesity or diabetes, hypertension. So whereas we still are grappling with the communicable diseases, the malarias of this like and diarrhea, now we have NCDs. The developed world don't handle the malarias and diarrheas. They are focusing on NCDs. So if we had a problem 10 years ago, now we have double the problem. So again, effort has to be done to ensure that we address the communicable diseases, but now also put in a bit more effort on the NCDs, which, as I said, are quite important. There's a lot that Uganda can learn from neighboring countries, but also other countries across the world. And I can give very many examples of what we could learn from several countries. One of them is that if you can look at the community health workers as an example, in areas where there's very low support to these volunteers, their performance is really low. Some countries have made a deliberate effort to strengthen the capacity of the volunteers or the community workers, including regular trainings, support supervision, ensuring that they are motivated, whether financial and non-financial. Another way we could think of learning from other health systems is health insurance. We've seen countries such as Rwanda have social insurance schemes that are not necessarily overburdening the community, but still people are able to invest some resources to help them when they need them. So I think as a country we need to do a bit more in learning from what has been done elsewhere, but more importantly putting into practice what we know. For example, we as researchers at the universities, we interact a lot with colleagues in other countries. So we have collaborators, in East Africa, in Europe, in the US and other parts of the world, who we work with quite closely in terms of implementing projects. We have visits to their countries, but we also read a lot of published literature online, systematic reviews, meta-analyses, and different studies that help inform us regarding what others are doing. If you talk about ministers of health, again, there are several fora that the ministers have where they meet and share experiences between each other. So in East Africa, we have the East African community where the East African leaders meet up and discuss health issues. If you talk about the African Union, again, the governments and ministers meet at that continental level. If it's WHO, again, we meet at the WHO regional office, but also at the WHO Geneva office. So at that level, there's also a lot of communication. Probably what is lacking is learning from local level, because if you look at a rural community as this one, it may not have a lot of links of learning, say, from neighboring countries. And one thing that we've done as an example of a local initiative is to have a WhatsApp group of community health workers, which is coordinated by a colleague at the university. So this group helps the CHWs communicate amongst themselves, share experiences, learn from each other, but also have that information shared at national level. So as part of the group, they are members of HIFA, which is Healthcare Information for All, which is a global platform of sharing information and knowledge. So information from the group is channeled upwards to that HIFA platform, but also the coordinator of the group helps channel information from the HIFA discussions right back to the community. And that is really one small initiative. I wish there was more, there were more avenues for such information exchange between the local and the global and vice versa. That could actually, I think, do quite well in learning from other health systems and supporting each other moving forward. If I wanted to target one critical area that I feel would really have a very strong impact on the health system in general, I would certainly target strengthening the community health system. Because if you look at where exactly the problem is, most of the time the issues are in the communities. We had a training today in this place, and the trainers who are health workers put a strong emphasis on household health. So what situation are we living in our communities? What sources of water do we use? Which food do we eat? Where do we dispose our waste? How do we keep our utensils? Because if you really target health at household level, you've done half of the problem. So if you, for example, invest a lot in the high-level health system in terms of national referrals and district referrals, yes, these need to be there and they are certainly very, very important. But if you really forget and not put emphasis on the community where people actually stay, live, get exposed to these risks that cause the disease and later on make them have to visit the health center, then I think you've not done a good job. So for me, my effort would be strengthening the health system at community level, but with a very strong focus on prevention and health promotion.